Transformation Manager in Adult Social Care for Cheshire West Chester. My colleague here is Nathan
Hi, I'm Nathan. I'm Project Manager in Cheshire West Chester Council as well.
and Michelle.
Hi everyone, I'm Michelle Taylor. I'm the Senior Manager for Strategic Commissioning for Adults at the Council.
So we were asked to come and talk to you today about co-production and an example of how we've used co-production within direct payments in Cheshire West. So we wanted to provide you with a bit of an overview of the direct payment work that we've currently got going on in Cheshire West. So we've by no means cracked it, I'm sorry to say. We're still midway through our journey, but we have really tried to use co-production within this piece of work, and we just wanted to share our learning and experience. But we also wanted to make this session a little bit interactive and learn from you about how co-production looks in your area and the challenges that you might face, so that we can all kind of share knowledge and collectively solve some of our shared problems and challenges. Next slide, please, Amanda. So just a little bit about us as a place. So we've got about 360,000 people that live in our area, in our borough. That's expected to increase by about 10% by 2038, with the largest increase in our over 65s. We support about 9,000 people with a mixture of short and long-term support. And we're a place of places. So we've got a university city of Chester, we've got industrial areas, market towns, rural hamlets. So very diverse borough in terms of all of the different people and places that we support. So we started our community-led support journey in about 2022. We focused on a number of key pieces of work. So that's included a lot of training for our staff around going further with our strength-based practice model, outcome-focused ways of working. We've developed our own sort of talking point offer, which we've called Let's Talk locally. And we're aiming to sort of align our focus across both operations and commissioning, as well as trying new sort of innovation areas and testing out new things within the community-led support approach. So that's all really brought together under our developing strategy, which is currently out for consultation. But basically that strategy is documents our ambition for community-led support and how we're going to deliver our vision, which is enabling great lives. So just wanted to sort of put that into context there. Kind of everything we're doing within the directorate all falls under that community-led support banner and approach to working. So I'm going to hand over to Nathan now, who's going to talk to you a little bit about co-production and our experiences. Thank you.
Thank you. So on the next slide, we've just got the ladder of co-production, or the ladder of working with people, really. So some of you might have seen that before, but as a council, I think an area of strength for us is our way we consult with people. So we're very good at consultation, but areas that we kind of like to develop and improve on is co-production. So we've got pockets of really good practice across the council. So with our community inspirers as part of the Poverty Truth Commission, and also people sitting on with lived experience sitting on boards. But that practice isn't widespread. It's not kind of the norm across our services. So that's something that we want to really embed co-production, and there's lots of work we're doing to do that. On this project, we really used the co-production way of working, so working with people ladder, to really adapt to the needs of people who come to work with us to improve direct payments. So looking at kind of what work do we want to really co-produce with people, what work do we want to engage with people at, and what work do we want to inform people. And that was guided by the group of people we've worked with, which we'll talk about a little bit more. But there was some people who wanted to work with us around training, but some people who actually just engage us in the policy. We don't want to kind of sit down and write that with you. So we've been really adaptive to the needs of kind of the group we've worked with.
So we're now bravely going to try and use a bit of technology with you to get your views on why you think co-production is important. So if you've got a phone, you can scan your screen to get the QR code, or there's the link in the chat there if you want to put it into your browser on your computer. And then Amanda's going to bring that up on screen. And basically what we're asking you is, why do you think co-production is important? And then hopefully by the marvels of technology, that'll bring up a bit of a word cloud so we can see all the reasons why you think co-production is important, and then see what chimes back to our kind of thoughts locally. So we'll give you a few minutes to get online and then start putting your thoughts in. Thank you.
I'll just leave the QR code up for a minute before switching screens.
Thanks, Amanda. Great, so you can see some responses coming through already. That's brilliant. Okay, so we've got about 45 responses so far, which is great. 47 going up, fab. So I think I was just referring back to our notes then as to the thoughts that we had, and it really chimes with a lot of what you've said here on the screen. You know, that voice of the person with lived experience being so powerful, and working in partnerships really effective. You know, those strengths-based approaches, and balancing the power, which I think people feel, you know, is a real issue when we work in the systems that we do. So we sort of thought in terms of why co-production might be important. Amanda, if you want to jump onto the next slide for me, thank you. So we thought that our services are enhanced when we co-produce. So working together allows us to better understand the needs and preferences for people and provide solutions to complex problems that people who don't have lived experience may not think of. We think that people feel empowered and feel more in control, and that leads to better engagement. We think that it leads to improved outcomes, as you've said, you know, harnessing those knowledge, skills and experience of people with lived experience, it's more likely that we achieve positive outcomes by doing that. We can use resources better when we co-produce with people, because people with lived experience often bring that really insightful, simple, common sense solution, you know, these things that don't break the bank but have a really big impact. And we foster trust and collaboration, so it creates that safe, equal environment where people feel valued and want to work together to make a difference. And ultimately all that leads to improving people's lives and enabling great lives, which is what we really want to do. So it's great to see that we're obviously all on the same page around why co-production is important. So Nathan's going to get into a bit about how we did what we did and what we learned. Thanks.
So would you mind going to the, that's brilliant, thanks Amanda. So yeah, in Cheshire West and Chester, we knew that we needed to improve the way we did do direct payments. We've got kind of lots of feedback from people, our colleagues. We know from kind of national statistics, we perform below the national average in the direct payments area. Our staff tell us it's not easy for to support someone to get a direct payment because of processes, skills and training. People who with lived experience tell us that actually a direct payment could be so much better if the support systems were in place to help them more. And obviously cost pressures, we face cost pressures on care and support, so we need to think differently about how we do care and support, moving away from that traditional model. So we've just kind of broken it down into a bit of a who, how, what, when, where of co-production to kind of bring to life a bit about how we've done it in Cheshire West and Chester with direct payments. So it come on the back of kind of a conversation with our site lead Amanda about how NDTI could maybe support us with this piece of work. So we knew that we wanted to do something around direct payments, and we knew we had some time to use with Amanda to do something, and we thought this is absolutely perfect. It embeds kind of the CLS principles, and it's a really good way of working together. So we brought Amanda along to our first project team meeting, and Amanda was very clear that we need to involve people from the very beginning. So there's no point in sitting around kind of saying, well, this is what we think needs to happen. We need to go to people and say, what needs to change here. So in terms of who we co-produced with, so we wanted a mixture of people really. We wanted people with lived and we wanted people with learned experience as well. So staff within kind of social care, staff within kind of our support services, so like client finance, also our colleagues and partners in kind of the NHS, the community sector. We wanted as many people really feeding into this who are involved in direct payments. So that led to us delivering a mixed session with kind of lived experience and learned experience, and we delivered a couple of them sessions, but kind of reaching those people. So we thought that'll be really easy. We'll just pull a list of people off our record system of all people who get a direct payment. Unfortunately, it's not that easy to pull that list off, and actually with things like GDPR, some people hadn't subscribed to us contacting them for things like that, so we weren't able to do that. But what we did do is we did a big social media campaign around it. So we used our council websites, our social media websites to really push kind of a message that we want to work with people to improve direct payments. And we also work closely with our community sector partners as well, and they were able to kind of support us in getting those comms out, and also our social care workers as well, so people who know people who get direct payments who would like to feed into that. And we did it to so our kind of direct payment service is delivered jointly between children and adults. So we brought people who have children who get direct payments and also adults who get direct payments together, and it worked quite well because we brought, especially through social media, we brought voices who probably would never come normally to us to co-produce. So I think we found in previous ways we worked, we get the same voices quite often who want to come and kind of give input, which is great. But actually there's some unheard voices. So going out on social media was a really good way of reaching those people. Then what are we going to co-produce? So it was kind of a bit like, what comes first, the chicken or the egg? Because we were like, well, we need to give people choice about kind of a venue, what times work for them, but then how do we do that? So we kind of compromised on it and we said, right, we'll offer a morning and a daytime session and an evening session. So that kind of morning session was available to everyone, like the evening session, and that was kind of led by people to book on, and the indication was that evening sessions were more popular, but we ran both anyway. And from that we started to build with people. So that first session we started to build what people wanted, so identifying themes that come up. In terms of kind of a when to co-produce, we've kind of started talking about that, but kind of offering a day and evening sessions. So thinking about school pickup times, so 3 o'clock isn't a good time to do it for people who have got children in school. Evening works very well for some people because if they've got caring commitments in the day, sometimes there's someone who can take over in the evening. People work full time, so it's about offering as much choice as possible. And in terms of where we were co-producing, so we didn't want to bring people to council buildings. We wanted to choose a neutral environment, which we were able to do. Location's really important. We wanted it to be accessible for people. So we chose, we're quite a large borough in terms of size. So we put 2 sessions on at different sides of the borough for people, and we went with a city centre location, which is really accessible transport wise, and also another town centre location to try and reach as many people as possible and make it as easy as possible for people. But that neutral building was really important because we wanted everyone to feel equal, and we've got a really good venue in Chester called the Story House, which was absolutely perfect for doing co-production. But as long as it's a neutral venue, it doesn't really matter about the building being fancy. And then if we pop onto the next slide. So yeah, in that first session where we brought people together, we asked kind of two questions, and it was kind of what works well currently with direct payments. And we got some feedback. We heard some really good stories about actually the kind of impact a direct payment can have on someone's life, that really positive impact that actually really changes your life. Then we asked what wasn't working, and in all honesty, there's quite a lot that wasn't working for people, and we've put some of them on screen just as some examples. I won't run through them, but I'm sure you can probably get a sense. And I think it's not just a local problem to Cheshire West. I think direct payments are a challenge everywhere. But giving people kind of that opportunity to speak and really kind of hear from them was so powerful, and really kind of useful in terms of the journey we're going on. And we were able to kind of start pulling some themes together from what people were telling us, and that's helped us build kind of that continuous journey of co-production. So if we just pop on to the next slide. So yeah, what people said they wanted. So we kind of split this into people who receive a direct payment, people who are paid with a direct payment, so like maybe a personal assistant, a micro enterprise, and then people who offer a direct payment, so quite often a social care worker. So in terms of people who receive a direct payment, they wanted it to have the all-encompassing kind of easy to understand training, so they wanted to feel really skilled to be able to be an employer and to kind of have that direct payment. They wanted to know about the range of ways they could use a direct payment, and we'll talk about that a little bit more as we go into the slides. But kind of we've got kind of that traditional kind of personal assistant approach, but actually there's so much more a direct payment can be used for. So people wanted to know more about that and understand it, and also to have information that was of good quality, clear, accessible, and provides at regular points. I think information, so people's understanding, so access to like our website page, what's on there currently, what could we do to make it better, where could we leave information for people who haven't got access to the internet. That's another really big thing for people who aren't kind of as digitally enabled as others. Then in terms of people who are paid a direct payment, again, training was a theme that come up quite a lot. So for personal assistant, they want to be clear on the training they need and how to access that training. So they feel like they're able to deliver the best service they can possibly do to the person they're supporting. And also to have a network of people. So so a network of people that they are also personal assistants or also workers kind of delivering micro enterprises, that they can come together and kind of share learning as a bit of a support network for each other. And then in terms of the people who offer direct payments, so kind of the social care staff, again, training kind of come up throughout as a theme that we saw in every area. But to be able to really tell people about a direct payment confidently and really kind of feel that they're promoting it in the right way so that people will really see the benefit from it. And again, knowing about the options available. And also to be able to offer direct payment as a kind of, rather than jump into that traditional approach of maybe care at home, actually a direct payment being that first kind of thing we think of. So that was some of the feedback from the staff, and from that we've been able to kind of pull out some themes of areas we want to work on. So there's obviously an area where we want to focus on training. Our policy we're kind of working on updating, making it easy to read for people, because actually when you read a lot of policies, they're not the easiest of things to understand. So if this is something you're new to and not really experienced in, or you're not used to kind of the language we use in social care, it can be quite challenging. So looking at our policy, looking at the kind of payment options available to people, and what we've done is kind of create kind of groups where we can focus our efforts with people with lived experience, and we've given people options. So for some people, training, they're not interested in training, but they'd actually really like to work with us how we try and kind of change the policy, so they're kind of on part of that group. We've got the right people staff wise, so we're quite fortunate that lots of staff want to, lots and lots of our staff want to improve the way we do direct payments across kind of the council. So having those people on those groups, so that's something that's an ongoing piece of work as we're kind of developing. So yeah, really exciting and really nice kind of getting the views of everybody and kind of building that together as a group. Next slide, Amanda, thank you.
And this bit's me.
So I'm going to hand over to you, Michelle. So we recognise that we need to kind of diversify our offer locally, so that people had more control and choice over how they kind of receive the support, which kind of led us to looking at working with community catalysts, which Michelle is going to tell us more about now.
Thanks, Nathan. Yeah, so Cheshire West secured some funding through the UK SBF Levelling Up to introduce the and pilot a micro enterprise approach. So like many other authorities across the country, our model of care at home, so our home care model, is very traditional, and what we are doing at the moment is we're looking at our transformational plan over the next 10 years to try and get it away from where we want to be, where we are now and where we want to be, and look at that alternative model that's built on CLS principles. So Cheshire West, as Emma said at the beginning, is a mixture of urban and rural, with over a third of our population living within the rural areas. We approached Comcats, and it's nice to see so many colleagues on here from Community Catalyst, back in late 2020, early 23, to work alongside and scope what micros could look like within Cheshire West. I'm sure most of you know, and I'm sure I probably will never give it as much gratitude as our colleagues on the call, but micros are mostly one-man bands, and they can be up to 8 employees, but focused on supporting people through care and support services. So linked to the changes within our DP policy that Nathan and Emma has talked about so far, we wanted to provide more choice and control for people whilst encouraging that the local pound stayed within the local area. So majority of our micros are local people who are setting up their own business. After initial scoping and understanding the market, we employed a catalyst who's actually on the call today. I can see Sonia within the area. And since Sonia's introduction just over a year ago, we've now got more than 40 micro enterprises working within the area, which is a testament to the work that she's provided, which provide a range of services from befriending to fitness to personal care. In response to that, what we also noticed was our financial modelling. So we went away and we reflected on how we currently pay our what rate we give to our micro enterprises. We recognised that it was probably more than a PA rate that we were currently giving them, but less than a care at home rate. So we introduced a micro enterprise rate, and that's made a significant change in people accessing micro enterprises. So since introduction of Sonia and her post, we have over 546 hours worth of support being delivered by over 40 providers. This is a mixture of DP users and self-funders because we are quite an affluent area. We do have a high percentage of self-funders within the market. We started to capture some of the differences that micros have provided, hence the case study that you can read on screen. What we have noticed is on top of the kind of additional support that these micros are actually seeing, it's that added bonus that people are receiving from the outcomes, and it is changing lives, and we're adding towards that community and strength-based approach. Next slide, please. Back over to you guys.
Yeah, so we just wanted to kind of give you a high level of kind of what worked well and some of the challenges we faced. So in terms of what worked well, we brought together a really diverse group of people, so people from varying experiences of direct payments. So those people in the room who receive care and support but hadn't really even thought about a direct payment. There are people in the room who have been using a direct payment for years, and there are people in the room who were kind of support people to have a direct payment, so personal assistants or micro enterprises, as well as our staff. So it was great kind of bringing those people together, and the conversations that were happening on the table were great, and I think learning happened between the people we brought together as much as kind of for us. So understanding why things don't necessarily work as well all the time, but how we can kind of collectively work on that. It definitely gave us ideas that kind of probably as a project team within the council we wouldn't necessarily have kind of thought of as kind of would have as big an impact as it would for people, but loads of really good ideas. And one lady kind of come up to us with a list of kind of, this is what I think you need to include, and give people a list like this so they're very clear on what they can use a direct payment for. And that list I carry around in my notebook, so I've got that. So, and I constantly refer, as we're going back to that, as we do that work, constantly refer back to that to make sure are we definitely covering that. And then internally, so all our stakeholders want to improve kind of the way we do direct payments. So kind of within our client finance team, they recognise that some of their processes can be quite challenging. So best on board to change things. Again, our contracts commissioning teams and our operations teams, we had a really good show of staff kind of come in and really give him their experience. And in terms of being flexible and adaptable, so I think we learned from a session. We had a bit of a loose agenda, but actually I think we got halfway through that first session and threw the agenda out the window, because actually we recognised we needed to change the conversation a little bit and to get the most out of the session for everybody there. We changed kind of some of the slides, and we were open and honest with the people there, and I think that worked well. And I think that flexibility and being able to be adaptable is really important. So it stays relevant, and you're listening to the people in the room with lived experience, and it's that joint approach, isn't it? It's not kind of the council have come here to say they're improving direct payments and we're going to do it this way. It's we're going to improve direct payments together. But yeah, so obviously with everything there were some challenges. So some learning kind of we took away was there was varying kind of understanding of direct payments in the room. So I think we probably assumed that everyone would have kind of a similar level of knowledge of direct payments. So probably learning for us was, if we were going to do something similar again, we'd do a bit of more of an introduction on direct payments. This is what a direct payment is, or maybe send out some kind of pre-information that people could have read through. In terms of not everyone wanted to come on a co-production journey with us, and that's absolutely fine. There were some people who come to those initial sessions and dropped off, and the feedback from them was kind of they wanted to come and let us know what they thought and kind of feed in some initial ideas, but they didn't see themselves kind of being on that kind of journey where we co-produce together. But I think everybody did say that they wanted to kind of know the outcome of it. So we've got the list of everyone who's come on this journey from the start. So we will update those people as we progress. In terms of in Cheshire West, we didn't have a standardised way to co-produce with people. So in terms of kind of, do we pay people for their time? Do we have a list of places where we co-produce that we can go to easily? So that's something that we're working on developing, and we've just appointed within Michelle's team a co-production manager lead to really drive co-production forward for us, which I think will be absolutely amazing for us within our council, and really help us as we move into co-producing in a lot of things we do. So thinking about CLS and those three cogs around everyone working together, that'll be a total asset. And then the cost associated with co-production, so it does require a little bit of investment sometimes to make it work. So we held an evening session in our city centre location, and we really struggled to get kind of a low cost venue. A lot of kind of venues we'd use weren't available during the evening, or they didn't have the capacity or didn't have the right facilities. So we ended up using a hotel, which obviously is more expensive, but where the hotel was located, it helped people get to it because it was by a train station, there was parking, and it worked. Also making sure that it's accessible to people. So we had a number of people from the deaf community who attended, who needed British Sign Language translators. So there's obviously a cost associated with that we needed to build in. So it's probably just being aware of kind of those costs and building that into the planning, and thinking about kind of we used the hotel the first time, but in the group I was kind of working with, they were like, well, my friend owns a Chinese restaurant down the road, he'll let us have his room upstairs. So there's a big function room upstairs, so we've been invited there to do some work, and I think we get a free meal as well. So it's kind of a really good way of people taking control, so we will definitely take them up on that offer. But yeah, so those are just some of the kind of things that have worked well and challenges, but it was just so amazing kind of hearing people's experience and really learning and being able to work with people to do it. And as Emma said at the start, we are on a journey, and we haven't fixed direct payments here in Cheshire West and Chester. We're on a journey towards kind of making it better for people, but we still recognise there's work to be done with our processes. There's work to be done kind of finalising what the policy looks like, our offer for people. But I feel like we're in a much stronger position because we are doing this with people. Next slide.
Great, thanks Nathan, thanks Michelle. It's great to see all the questions coming in the chat, so we'll definitely pick those up at the end. I don't want anybody to think that that we're missing those. We'll capture those through the Q&A. But just right now, we just wanted to go back over to you. So first we asked you why you thought direct co-production was important. And now I guess it's just a bit of a sense check in your individual areas. How would you describe co-production at the moment? So if you could use one word to describe co-production in the area that you live or work in, what would that be? So if you could go back to the Menti, it should have already skipped over to the next survey. And then same as before, we'll have a look at the results of what you're telling us. Thank you.
Bear with me, sorry people, I've just lost the Mentimeter. I'll get it back for you.
We can keep adding our words whilst Amanda brings it back, and then it'll be a surprise. Just to let you know, if anybody's one word is amazing, everybody is going to want to contact you. So if you say you've cracked co-production, could you please put your name in the chat, because we'll all be wanting to come and hear from you.
Amanda, do you want me to try and share my screen?
Yeah, it's telling me the session's no longer active, Nathan. Apologies. And I'm pasting it out of your slides. If you could, that would be great. Thank you.
Thanks both. The joys of technology on a live session. Great. Okay, so lots of responses there, and maybe a few more to come. 45 people on the call, so maybe a couple more responses to come, but we'll pick up what we've got there. So yeah, so I think kind of that inconsistent, I saw a gathering pace earlier. There's something about sort of, wanting to do this properly, key people needing to be involved. It's a little bit variable. So I think lots of areas kind of feel that at the moment. We're trying to do some of this stuff better. We're not getting there, but we are trying to do that. And we're definitely on a journey. So it's really, it's good to see that we're trying to sort of make progress in this area, but at the same time, I think it's we can all recognise we've got quite a way to go in terms of those where we are and where we want to be. The next question that we wanted to ask you was really to think of, if those are your words to describe co-production, and I guess I'm hearing that there's probably quite a few challenges. I just wondered what your top 2 challenges were with co-production, because if there's some consistent stuff here, maybe that's the stuff that collectively we can think about how we can how we can solve, or if we can share any learning. You know, I'm sure for somebody's challenge, there's somebody else who's got a solution for it. So just an opportunity really to have a conversation about our challenges within the Q&A discussion, and we'll pick up any conversation or questions in the chat at the same time. So again, same process. If you just pop in your 2 challenges into the Menti, please. Great, thank you very much for all of your responses. So it'd be really interesting to have a conversation about some of these things. So I'm picking up there's a bit around staff buy-in, communication, funding, time, you know, resources in its most general sense, processes, and where to start. And I guess for us it was start somewhere, like start small, give things a go. Very often we think we have to go big bang whole system, everything all at once, and sometimes that's great and it really works, but equally you sort of get into this bit of paralysis where you can't do anything because everything feels so big. So we just kind of took the approach of let's try something, and equally, you know, Michelle's done some great work around our day opportunities work as well, you know, in terms of co-production. So we've just sort of taken our opportunities as they've come and thought about how could we think about this differently. So so I guess in terms of where to start, it would just be pick something and try it. People aren't going to criticize us for trying, I think, if it's done in the right way. And I think, you know, in terms of funding and resources, there was a question in the chat over did we pay people to contribute? And for this particular one, no, we asked people to just come and give up some of their time to engage with us in the way they felt most comfortable with. What I would say is, as a council, we're looking at what our approach to co-production is. So that's something about those consistent standardized processes and policies that we know we need to pick up and work on, because people's time is valuable. And I think in terms of communication, we talked to some of our service users and our people with lived and learned experience in those groups and asked how we could communicate with them. So sometimes the easiest thing to do is to ask. You know, and just try and get a group of people together and ask how people want to be communicated with and what works best for them. So I think if we move on then, oh, Amanda, are we going back to Amanda? Yeah. Oh, marvelous. So the rest of the session is really a bit of a question and answer. So I've been trying to follow the chat. Apologies if I've